Hi, and welcome to the School Health Educators Podcast, where we discuss health education and how to best teach health ed in the K 12 setting.
Hi, and welcome to the School Health Educators Podcast. I'm your host, Lori Reichel. I want to ask you a question. Do you know how to explain to young people the difference between emotional health and mental health? Sometimes those phrases are used interchangeably, in which this episode is going to separate those two items with an activity that I created for my students in the classroom. So what I'm going to do is show a PowerPoint, a very, very simple PowerPoint, if you're able to watch this on the School Health Educators Podcast channel. If you can't, that's cool. Listen on. Yet, please make sure you check out the link for the activity. The answer, it's actually a link for the answers for the activity, the answers that I use in the classroom. Okay, so let me start sharing my PowerPoint with you. The title is Emotional Health and Mental Health. So a little fact or myth. I think you already know the answer to this if you listen to my intro. Fact or myth with this statement: emotional health is the same thing as mental health. And the correct answer is it's a myth. That's a myth. They are not the same. They're different, yet they work with one another. They have this relationship. Now that statement can be used as an anticipatory set for a very simple lesson on functional health knowledge of emotional health versus mental health. And the activity is printing out the document that I provided on the School Health Educators website that notes a table of what I perceive to be better fit into emotional health and what I perceive to be a better fit for mental health. And on this document, what you would do is you would print it off on a piece of cardstock and then cut out all the little parts of it. So each statement will have its own little teeny piece of cardstock. Like, for example, there's something that reads emotional state. That would be on a little piece of cardstock. And on the cardstock too, you would print out emotional health and mental health. And then when you're in a classroom setting with students, you would put them into small groups, and every group would get one of those sets from the cardstock. So you'd have to print off more than one piece of cardstock with this information on it. I hope this is making sense for you. So you print that off and you cut it out, and every group gets what is cut out for every group. And then they have to attempt to align the little pieces of cardstock to, does it belong with emotional health or mental health? And then you have a discussion afterwards. So it's a very simple discussion, and it's a very simple activity, yet we need to separate the two things. We need to separate them. I keep on hearing a lot in the news and even with organizations that this will improve your mental health. If you're talking about things that are dealing with feelings, that's emotional health. And we need to teach young people about how to feel their feelings. What are they feeling? To even identify their feelings. So if I'm feeling yucky because we had a lot of snow where we live, we had 16.5 inches, and we had to do a lot of shoveling and all, yet we're safe, very, very blessed. I feel blessed for that. So to talk about, well, I feel cold because of the snow, yet blessed because we have a roof over our heads and food in our bellies and all. But that's a feeling, that's emotional health. And when we want people to be healthy mentally, we also want them to look at their emotional health. So that's why this activity I created, because I want students to see that they're related, but they are very, very different. And as an educator, I recognize young people, they don't necessarily pause to recognize their feelings. And we need them. We need to teach them to recognize their feelings and then to express it with an I feel statement of I feel, fill in the blank. So, for this activity, when you download it from the School Health Educators website, you'll see the following that I put under emotional health. Deals with matters of the heart, being aware of one's emotions, identifying a variety of feelings, emotional state, expressing one's emotions, ability to cope with and regulate emotions, ability to cope with both positive and negative emotions. Sometimes emotions are yucky. All of us have that. Also with emotional health include stress and anxiety, self-esteem, knowing oneself, seeing the positive in life. Now, some of you might be thinking, oh, I would put this in mental health. That's fine. If you've noted some of the things, some of the concepts that I said, you're like, I think this aligns here. Do that and have a discussion with your students. Again, the whole point of this activity is to say that they are two different things, but they work with one another. Because this is what I have noted under mental health. These are the concepts. Mental health deals with matters of the head, the brain's overall function, thoughts and perceptions, ability to think clearly, decision-making, thinking, mental state, behaviors relating to the mind or brain, illnesses that can be the result of trauma or chemical imbalance, searching for new opportunities to learn, engaging in hobbies, keeping up to date in current events, learning from mistakes. The overview that I typically will give students is that emotional health deals with how we're feeling. Mental health deals with how we're thinking. And I give this classic example of, let's say that you meet somebody and maybe you even have a meal with them and they're really nice and maybe they pay for your meal and they seem to brush their teeth and take care of their hygiene or whatever you want to say. Yet your gut, you have this feeling that something isn't right. You just feel awkward. Something doesn't feel right. Yet in your brain, you're like, well, check mark, they seem like they're hygienic. They seem nice. They paid for the bill. Check, check, check. What we want to teach our students is to go with that gut, to go with that feeling of, wait a minute, I'm sensing something. Because typically, and those of us that have been in romantic relationships, your gut probably is sending you a message that it might take you a couple of weeks to finally go, I knew this all along, but I chose to hang out with this person anyway, yet this person isn't healthy for me, or I can't have a healthy relationship with this person. My gut told me right away. So we want to teach that gut reaction and have young people listen to their feelings because that'll help them in personal relationships. It also helps them with safety. So, to review, there is a difference between emotional health and mental health, although they are connected. Emotional health is more related to our feelings, mental health more of our thinking and what we decide. So thanks for watching and listening. Please remember to subscribe and like the School Health Educators podcast wherever you're listening from. Check out the School Health Educators website. And last but never least, thanks for doing what you do. The young people need us, so thank you for doing what you're doing. And stay well this winter. I hope that you're warm and safe.